I'm Robin Morrison. I'm a practice management and marketing specialist for dental practices. And today I'm here with Linda Miles. Linda, I have some questions for you today.
Okay.
And it has to do with best practices for associate transitions. Can you give us some tips on that?
Absolutely. I loved talking to senior dentists, associate doctors, and team members about this very important subject, because I've seen too many associateships fail in my 36 years of consulting, and I honestly believe that there has to be a few quick rules. Number one, the senior dentist sometimes forgets how they were their first or second year in practice, so they need to never ever say anything to the team, or they should never reprimand or train the associate with patients and team members. You praise publicly, you train and reprimand privately. But that is the first rule for the senior dentist, and they cannot micromanage, and they cannot just give the younger dentist the leftover dentistry. It never builds trust between the patient and between the team and the associate. So rules for the team members. So many times when the senior doctor is not in the practice that day, the telephone rings, a patient has an emergency, and the administrative team says, "Oh, I'm sorry to say that Dr. Senior is at a CE course today, but you could see our associate." Now, when you say you could see our associate, that means second best. Never refer to the associate as the associate. They have names, Dr. Senior and Dr. Junior, or whatever their name is, but they should say to the patient instead, "You know, Mrs. Bailey, Dr. Senior would not want this to wait. He would want you to see Dr. Junior, who joined our practice since you were here last. Our patients love him, and you're going to really be in good hands." They have to promote, promote, promote. Praise should flow freely, especially the first year the associate is on board. And there are some rules for the younger dentist. The number one rule, and I find this very frequent with female associates, when the team members know that that person is probably also an employee, they want to buddy up with the associate. They want to take him or her to lunch. They want to invite them to their home for dinner. They want to fuss about how things are with Dr. Senior, and that's going to happen. And it's great to go to lunch as long as the whole team goes, but the younger dentist cannot become a good friend of any of the team members, and they need to keep their distance if they're already a friend of that person. And that is, if the conversation ever turns toward a negative, toward the practice policies or the senior doctor, the younger doctor has to smile and say, "I understand how you feel. Let's invite Dr. Senior. This is his or her practice, and we need to involve them in this conversation."
That's a fantastic recommendation.
They don't take part in the gossip, and they're going to want the younger dentist to do that.
Right, right.
Everything has to be praise, appreciation, support, and acknowledgement. There can't be any criticism, and there can't be any buddy-buddy.
Right, that makes perfect sense. And you're right, that's something that we see happen in this situation.
Absolutely.
Yeah. Any other gems you have for us on that?
I think I've covered all the bases, because the patients, well, first of all, the team accepts what the senior doctor accepts, and the patients accept what the team accepts. So if you want this young doctor to flourish and reach their full potential in no time, they need a lot of support, but the younger doctor has to do their part.
Right, right. Well, thank you so much for sharing those tips.
You're welcome.
I'm sure it'll be very useful to all of our listeners.
Great.